A trans woman can undergo HRT because it might help her mentally and physically. Hello, I'm Maki of My Transgender Date, the #1 dating site for trans women. Before we dive into today's topic, don't forget to subscribe to our channel and hit the notification bell. We have a new video out for you every week that you don't want to miss. The topic for today is Hormone Replacement Therapy, or HRT. I will be covering the basics, like the reasons why some might undergo HRT, the types of medication that are used, and many more. Just a disclaimer though that I am not prescribing or suggesting anyone to take any of these. You should absolutely consult a health professional so they can better assist you. So let's get to it, shall we? A trans woman can undergo HRT because it might help her mentally and physically. Gender dysphoria is a real thing, and some trans women feel differently when they are not on hormones. I remember the first time I was introduced to hormone replacement therapy, I was 18. Prior to that, I just really wanted to look feminine, and it was life-saving for me when I started taking birth pills at that time. So it helps. There are trans women who feel more at ease when they know they are taking hormones, but please do not think that hormone levels are what defines one's gender. Some trans people are perfectly fine and functioning well without the need of hormones. I'm just saying that it can be supplemental to help with gender dysphoria and mental health. HRT can also help with physical characteristics aligning with a trans woman's gender. Effects can be different from person to person, but generally it can help with reducing the growth of body hair, lessening muscle buildup, making skin more supple, and overall it brings out more feminine characteristics. There are two main types of medication that trans women use when they are under HRT. There are doctors who prescribe both and others who advise to use just one. It really depends on each individual and their hormone levels. The first one is estrogen. Estrogen is the more dominant hormone in most cisgender women. This deals a lot in terms of feminization. This can be taken alone because some studies show that having a high level of estrogen can already suppress testosterone production. It also helps to develop feminine characteristics such as breast growth and redistribution of fat. The second type of medication is anti-androgen, aka testosterone blockers. Hormone replacement therapy is typically recommended at the age of 16 to get the maximum effect of feminization, especially when the individual is planning to undergo gender reassignment surgery. Anti-androgen is considered the saving grace for trans women who did not start HRT at an early age, which I agree. I remember taking anti-androgen when I was 24, mid-20s, and it did really help a lot in body hair growth. So it helps. Like any medication, HRT can have both positive and negative side effects. These may or may not be applicable to you. Here are some of the pros. Lessens gender dysphoria, reduces anxiety and depression, increases breast tissue, lessens acne and sebum production, smoothens skin, reduces male pattern baldness, lessens facial and body hair growth, decreases follicle stimulation, reduces prostate size. And some of the cons: lowers quality and sperm count, which is a problem if you're planning to have biological children. Decreases libido, reduces physical strength, increases mood swings, intensifies food cravings, increases visceral fat and fat mass. I will also be telling you the dangers of HRT. Now, let's get this straight first. I did not create this guide to scare anyone off from doing HRT, but I feel that everyone has the right to know all the information before undergoing it. Based on a study done by Dr. Darius Getahon on transgender individuals, which I will be linking in the description, trans women who undergo HRT may be at a higher risk for cardiovascular problems like stroke, heart attack, and blood clots. They are twice as likely to experience these blood clots compared to people who are not taking these medications. They are also 90% more likely to have a heart attack or a stroke. These are the risks you have to consider when you undergo HRT. And if you already have underlying health conditions, it's best to avoid HRT altogether. All of these considered, there's one more important thing I have to mention: the cost of HRT. The cost of HRT depends on the country that you live in. If you're lucky to be living in Canada, medication and gender reassignment surgery are free, granted that you have passed the qualifications and psychological evaluations. For the US, you can seek help from transgender organizations. For the rest of us, it can be quite expensive or worse, inaccessible. The first thing you have to consider when doing this is doctors. It's important to work with a healthcare provider when undergoing HRT the right way, but bear in mind that these visits are going to cost you. You would have to go to an endocrinologist and undergo several lab tests. In other countries, you have to undergo a psychological evaluation too. Medication. This is what you have to truly prepare for. In the Philippines, hormone replacement therapy can cost $50 and more per month, depending on the type of medication you're prescribed. In India, it can be $13 to $20 monthly. So it really depends on where you are in the world. If you're not financially ready, hormone replacement therapy may not be for you. For now, it's something that you can't just take on and off. Starting, it requires maintenance. This leads to the last but most important question. Should you do HRT as a trans woman? I'm not here to encourage or discourage you to undergo HRT. This video is merely a guide for you to know what hormone replacement therapy is. No matter what you choose to do, remember that you are a woman on the inside first. If you're still not sure if you want to take HRT or if you're not financially ready, that's okay. Everyone has their own pace and progress. Thank you for watching this week's episode. I hope you learned something new from this topic today. Let me know about your experience with HRT in the comments. I'd love to know. And if you enjoyed this video, don't forget to give me a thumbs up. See you in the next video.